RCBV, or relative cerebral blood volume, measures the volume of blood in the brain tissue. In a stroke, decreased CBV indicates reduced blood volume, which may suggest ischemia or tissue infarction. RCBF, or relative cerebral blood flow, quantifies the rate of blood flow through brain tissue. Decreased CBF signifies impaired perfusion, often indicating the presence of ischemia and stroke. MTT, or mean transit time, calculates the average time taken by blood to pass through the cerebral vasculature. Prolonged MTT is associated with delayed perfusion, potentially indicating areas of ischemia or tissue at risk of infarction. Tmax, or time to maximum, measures the time it takes for a contrast agent to reach its maximum concentration in brain tissue. Prolonged Tmax suggests delayed perfusion and may indicate areas of ischemia or penumbra, where tissue is at risk of infarction without prompt intervention. A favorable mismatch occurs when there is a substantial difference between the volume of the ischemic core and the volume of the penumbra, indicating a larger area of salvageable tissue compared to irreversibly damaged tissue. This would suggest a greater potential benefit from reperfusion therapies. The ischemic core represents irreversibly damaged brain tissue. It is typically identified by areas of significantly decreased RCBV and prolonged Tmax on CTP. These regions have severely compromised blood flow and are unlikely to recover without intervention. The penumbra represents potentially salvageable brain tissue surrounding the ischemic core. It is characterized by moderately decreased RCBF and prolonged MTT, indicating reduced but still viable perfusion. This tissue is at risk of infarction, but may recover if blood flow is restored in time. Understanding these parameters in CT perfusion imaging helps in identifying regions of compromised cerebral perfusion, guiding clinical decision-making in stroke management and intervention.